Welcome back to the 9 News Business Buzz. I'm Ryan Frazier. We often talk about the economy in terms of tech hubs and retail sales, but a most vital piece of our economic infrastructure in any Colorado community is its hospital. Right now, our rural healthcare system is facing a severe financial crisis. According to the Colorado Hospital Association, 84% of rural hospitals are operating on unsustainable margins. Facing skyrocketing costs and low reimbursement rates, many facilities are being forced to cut essential services just to keep the lights on. Joining me to discuss the raw economics of keeping rural hospitals open is Jennifer Riley, CEO of Memorial Regional Health in Craig, Colorado. Jennifer, welcome on the program.
Thank you. Nice to be here.
I'm excited to have you. Thanks for coming all the way from Craig, Colorado, here to Denver. Jennifer, let's talk a little bit about what's going on in our rural hospitals. Now, we know that rural hospitals are on thin margins. You all are facing a number of issues in terms of patient volumes, reimbursement issues. You've mentioned workforce to me offline. Talk to us a little bit about what it takes these days to run a rural hospital here in Colorado.
Yeah, it's a challenge. Rural hospitals are operating in difficult financial times. Like you said, our reimbursement is a difficult subject. Over 60% of our payer mix, which is Medicare and Medicaid, don't cover the cost of providing care. So that means the payments that we're receiving from those payers don't even cover what it costs us to deliver the care to those patients, which is significant. I mean, my hospital, it's about 50% of my payer mix is Medicare and Medicaid, but in some cases, in some rural hospitals, it's upwards of 70%. So that's the majority of the payments coming in aren't covering those costs. And there are very few opportunities to find other ways to generate revenue in a hospital. And so we've seen across the state a number of closures in the last 5 years. 5 labor and delivery units have closed across the state, most of those in rural areas. 3 behavioral health hospitals have closed across the state. Home health and hospice services have closed across the state, and these have ripple effects across those communities.
You know, when you have Medicaid paying you 67 cents on the dollar of cost to provide care, and Medicare providing you 72 cents on the dollar, basically, and roughly 50 to 60% of your patients are Medicaid or Medicare. So you're taking 30+% cut, if you will, or loss, if you will, to serve those patients. How do you keep the doors open?
Well, what ends up happening is a lot of those costs, a lot of that gets shifted to commercially insured patients. So we're getting a better reimbursement from those patients. We look at service lines that tend to be more profitable, like surgical services. If you have a robust orthopedic service line like we do, that helps generate revenue to offset some of those losses. We had to close labor and delivery and home health and hospice because we couldn't afford the losses that we were sustaining in those service lines. We have other service lines that we need to make sure are available year-round, like emergency medical services, ambulance services. That's another very poorly reimbursed service, but critical for life-saving measures in our community. So we look at profitable service lines like surgeries to help offset those others that don't make as much money.
I want to shift to the broader economic impact in rural communities, because as we both know, oftentimes hospitals are a bit of an anchor in these communities. So when you see rural hospitals over time closing services like labor and delivery or behavioral health or outpatient surgery, what's the impact on the local economy's ability to attract new businesses and young families that want to have a good hospital nearby?
Oh, absolutely. So most rural communities, the hospitals are the largest employers. Our community is one of those that we are the largest employer, and we generate about $70 million of economic activity. Every employee that works for us, 80% of our employees live in our community, and they're buying groceries, paying taxes, generating additional revenue throughout the communities. So when we closed a service line and we lost staff because of that, that's going to have a ripple effect in the community. Those people are going to move to other communities where they can work. That's going to take those tax dollars out. When you look at recruiting new businesses, when you look at recruiting workforce to another anchor institution like a school district, they're going to look at what services are available in your community. Is labor and delivery available? Are these outpatient services available? It's great that we have a hospital, but what else is there and what's missing? And that's going to affect those decisions for those people considering to coming and working in your community.
Yeah. Now, you're sitting in the CEO of a rural hospital seat, right? And you talked about workforce. I want to unpack that just a little bit further with you, Jennifer. Recruiting specialists can be very expensive, let alone others in the workforce you need to serve the community. How do you innovate in this space to recruit the talent that you need in order to serve the community that you operate in?
I think rural hospitals are excellent at innovating, and we're excellent at working with each other. We work with other rural hospitals, we work with other health systems, we work with other independent hospitals that are bigger than us that have services available that we need. I don't need a full-time cardiologist, but I have people who need cardiology, so I partner with another hospital to bring those services to Craig. I have the specialist that comes to Craig on a monthly basis. We take care of them as it's appropriate to do at our hospital, and then the bigger things, the bigger surgeries, the cardiothoracic surgeries, those go to that other hospital. So it really becomes a win-win situation. We look at are there opportunities to share critical services? We share an orthopedic service line between our community and another community. So we're bringing really specialized care to our hospital, but not on a full-time basis. But that's what works in our community. And we're not unique. Rural hospitals do this across the state. And rural hospitals, I say this in almost every meeting, healthcare is an ecosystem, and we all need to be successful. Rural hospitals need to be successful, so bigger system hospitals need to be successful. We need system hospitals to be successful because they support us in rural. We all need to do well in order for healthcare to be effective in Colorado.
Yeah, whether it's urban or rural, we need hospitals and good health care. It's a stark reminder that the financial health of a rural hospital is directly tied to the overall economic survival of every rural community. Jennifer Riley, CEO of Memorial Regional Health, thank you so much for coming from Craig, Colorado. For the 9 News Business Buzz, I'm Ryan Frazier. Have a great week.